Welcome to the High Impact Man podcast. High impact men from across the nation sharing their stories of inspiration, encouragement, and hope.
Gosh, seek transformational relationships.
Now, what you're hearing from the culture is not right. Pick up the six, you know what I mean? But you never know who your six sometimes is.
Stop being less.
To help others become the virtuous leaders they're called to be and that our nation desperately needs.
All right. Hello, everybody. We're here with another episode of the High Impact Man podcast. This is Nevin Gorky. You guys in F3, you know me as DFib. My co-host, Troy Klinger, otherwise known as Dial-Up, is having some technical difficulties, so we can't hear him. But our guest today is Dr. Marty Makary, and it is an honor to have him on here today. We're going to have to get rolling quickly because he has another meeting in 30 minutes, so we're going to just get right into it. First of all, Dr. Makary, welcome to the podcast.
Thanks for having me, and Evan, good to see you.
Yes, sir. I don't remember if you and I ever actually met, but Dr. Makary comes from the same town that Dial-Up and I live in, which is Danville, Pennsylvania. But before you were anything else, you were an Ironman, I guess. And
Danville High School.
Yeah, baby. And we have some mutual acquaintances, not the least of which are your parents. I know them quite, pretty well. I worked with your dad. His dad, Otto Makary, is a physician. He works at the medical center here in Danville called Geisinger, which I work at and Dial-Up works at. Of course, he's retired now, right? Last time I talked to your dad, he was over in Egypt.
Yeah, he likes to go from time to time. Yeah, he's back.
Okay. So actually, he was a hematologist at the hospital, and I work in cardiac surgery, but I spent 5 years in the outpatient cancer clinic, and so I did work with your dad. It was at the end of his career, right, when he was getting into retirement. So, and his dad is a really wonderful man, and really enjoyed working with him, and a blessing to the community, obviously. So, some of our mutual acquaintances, we got Scott Hassenbach and Jonathan Spar and guys like that. So they'll be really interested in hearing this, I think.
Oh, that's cool.
Yeah.
That's awesome.
All right. Thanks. So why don't you tell us, where are you coming from? Are you down in Baltimore right now?
I'm in Baltimore. I just got out of the hospital, and I don't even know what I'm doing in 30 minutes here, but I know my assistant's got something lined up. So
something lined up for you. Yeah. All right. Well, Dr. Makary is a professor at Johns Hopkins University School of Medicine and author of 3 different New York Times best-selling books, The Price We Pay, Unaccountable, and the book that he's most recently written, and it just came out. I think it came out in September. I had pre-ordered it, so I ordered it ahead of time. I think I got it in September, and it's called Blind Spots, and we'll put a picture up of the book for people that see us on YouTube. And so I do obviously recommend the book. Dr. Makary you started out your career as a surgical oncologist and a pancreatic specialist, correct?
Yeah, I took a break from med school after 3 years, went to graduate school for public health. Then after my public health degree, got back into the clinical game and did a residency in surgery and then fellowship in surgical oncology and gastrointestinal surgery.
Yeah, obviously, and now you serve as a member of the National Academy of Medicine and Public Policy Research, and you lead Johns Hopkins initiative on the redesign of healthcare to make healthcare more reliable, more appropriate, and more affordable, especially for vulnerable populations. And because of that, it seems like you always had an interest, and I read it in the preface of your book, in what happens in public healthcare. And even though you were a surgeon at heart, you really got into public healthcare and stuff. And many of you may have seen Dr. Makary on various news shows talking about different things, and I guess the most you were on about was the COVID epidemic or pandemic. So anyway, that's who Dr. Makary is. And we want to talk about this book, Blind Spots. The subtitle is When Medicine Gets It Wrong and What It Means for Our Health. So tell us what caused you to write this book. I mean, I could read it from the preface, but it's better coming from you.
Well, I think there's a lot of big questions in medicine that are quickly dismissed. And you notice this in med school, as we sort of get conditioned as students early in the training. Giant questions existential threat to the society level questions are just kind of written off, just dismissed quickly. For example, I remember learning that the sperm counts of Americans are going down and are 50% lower today than they were just 50 years ago. And I remember asking why. And it was just kind of like, oh, there might be a lot of factors and we don't know, and just kind of go back to memorizing and regurgitating for the test. And there's a lot of these things, a lot of these giant questions. And the reality is that we have been witnessing an entire group of chronic diseases skyrocket in our lifetime. And we have never really been asking the big question of why. Early onset Alzheimer's, that is, remember the description the excuse we were told, well, these chronic diseases are going up because the population is getting older. Well, that's not real. I mean, that is true, but that's not the reason. Autism is now 1 in 22 children born in California today. Half of our nation's children are obese or overweight or pre-diabetic. Autoimmune diseases have skyrocketed, now affect 1 in 5 women. Colon cancer is on the rise in young people, and nobody is asking the big questions. And it turns out there's a fairly robust body of literature in science and in medicine that does give us the answer, or at least point to likely causes, but they have been in our blind spots. We are sort of busy billing and coding and doing our throughput related activities in hospitals. And so these are the big questions I've always been interested in.
Oh, thank you. And you not expose, but you bring to light a number of these different things, and not only not asking the question of why these things have happened, but in some cases we kind of know why certain things were happening, but we were, to use the new term, misinformation. I mean, some wrong ideas were put forth for a while that took a long time to get corrected. And I'll just start with the first chapter, the peanut allergy epidemic. Can you talk to us about that?
Yeah, first of all, you could not be more correct. We have had an epidemic of misinformation, a lot of it coming from the United States government and from experts, namely the food pyramid, demonizing saturated fat as we've ignored the role of refined carbohydrates, added sugar, and ultra-processed foods that kids are now addicted to, society is addicted to. In the case of peanut allergies, there's another good area where we've not been asking the big questions that we should be asking. Why is it that there are no peanut allergies in Africa? It's not a genetic disorder. Why is it that peanut allergies were rare, and often when they happened, they were mild just 2 generations ago in this country? Well, it turns out that the American Academy of Pediatrics decided to give advice on how to prevent peanut allergies, and that advice caused peanut allergies. They got it backwards. They told parents to avoid peanut butter until a kid turns 3, thinking avoiding it would reduce the risk of future allergies, but they got it backwards. They ignored the concept of immune tolerance, and they ignited the modern day peanut allergy epidemic. And for most of the last 25 years, pediatricians have given the wrong advice if they were following the guidance from their association. Now, some were not, and they used their own logic and common sense and understood the immunology principles. But it's really amazing that the modern day peanut allergy epidemic was, by and large, ignited by the medical establishment's hubris.
Yeah, and that was always interesting to me because I work as a physician assistant since 1989, and growing up in the 1980s, I was when I graduated high school in '84, to give you an understanding, and somewhere around the late '90s, 2000, I was asking, where are all these allergies coming from? Because I didn't remember anybody growing up that had a peanut allergy. We didn't have to worry about, you're having a birthday party and wondering if some kid's going to die from a peanut allergy, and all of a sudden it's an epidemic. So interesting to find out that it's kind of self-inflicted. And go ahead. I'm sorry.
And you don't see an apology from the medical establishment.
Right.
The folks that made this disastrous and catastrophic recommendation. Choosing not to do a scientific study first, but instead just issuing a broad recommendation.
Yeah.
The most dangerous thing you can do in medicine is to issue a strong recommendation with such absolutism when it's just a gut feeling, when there's no scientific support, and then suggest that your recommendation is based on science. And so we have a massive problem in healthcare today, and that is a distrust of doctors and hospitals. A study just came out, you may have seen it in JAMA's journal, Open Network. Trust in doctors and hospitals went from 71% to 40% over the last 4 years. That's a 31-point drop. Right. So we have an epidemic of distrust that we need to address. And part of that healing is acknowledging when we make mistakes and putting out the corrected recommendation with the same vigor by which the initial recommendation was put out there.
Yeah, and I think it's really hard once it kind of is out there and gets into. I think, one of the things you talk about is groupthink, but also among the populace, right? I mean, once something takes hold, it's really hard to turn back and say, oh no, that's not what it is. At least that's my experience with my family members and with patients. They have ideas that are. And do you think social media contributes to the distrust and the cynicism that exists now?
I don't know. I think it cuts both ways. I think on one hand, it polarizes people and affirms what they already believe and can promote closed-minded thinking. On the other hand, it is a vehicle to communicate information, and part of that can be educating people about a different perspective and getting the truth out there. So a group of us doctors have been going directly to the public to try to educate people about health, about the big topics in health that we're not talking about that we should be talking about: the microbiome, gut health, the appropriateness of care, when to get a second opinion, the role of ultra-processed foods, seed oils, refined carbohydrates, microplastics, all the different topics I touch on in the book. But really, I would say raising the topics that we otherwise never talk about in modern medicine. Peter Attia is doing the same. Casey Means is out there. All of us are out there on podcasts. We're writing articles. We're writing books. We're talking. So social media has enabled a lot of us to get our message out there.
Yeah, so it's a vehicle both ways, right? So
yes.
Actually, I shouldn't bash on social media because that's what we do here right now, right? All right. You did talk about the gut biome. You mentioned the gut biome there briefly. Can you just give us a little bit of a brief description of what we've done wrong and what we can do to help ourselves in regard to the gut biome?
So we're increasingly recognizing that the central organ of health is not the heart, it's the microbiome. That is the lining of the gastrointestinal tract with millions of different types of bacteria that normally live in a balance. They live in a harmony. And we are altering that balance, causing a reduction in the number of the types of bacteria, a decrease in the diversity of that microbiome, and sometimes overgrowth of bacteria that live in an imbalance that can increase general body inflammation. Now, this microbiome, this lining of the GI tract of bacteria, is part of nature. Those bacteria are involved in digestion. They don't just sit there. They're busy. They train the immune system. They produce some vitamins. They regulate hormones. They even make serotonin. Most of your body's serotonin is made in the gut. Well, that's an important molecule for brain health and mood. So we have under-recognized the importance of the microbiome, and we have assaulted it in so many ways in the modern world. Not just what we eat, but also antibiotics that people don't need. 60% at least of antibiotics prescribed are unnecessary. Well, those antibiotics are often given with the dogma that, they won't hurt you. They may not help you, but they won't hurt you. We've all heard that.
Right.
No, they carpet bomb the microbiome and they alter the microbiome. And in studies now from the Mayo Clinic, where they've looked at kids who have gotten antibiotics in the first couple of years of life compared to matched kids who have not, kids who take antibiotics in the first couple of years of life have higher rates of asthma, learning disabilities. They're more likely to have celiac, more likely to be obese, something that farmers have noticed in animals that routinely take antibiotics for decades. And so we don't want to create fear. Antibiotics save lives and they're critically important. They enable us the opportunity to do surgery, but they're also massively overused. And we have to recognize that when we're taking antibiotics we don't need, they are altering the microbiome. Pesticides, if pesticides kill insects, what do you think they're doing to the microbiome of the gut? I mean, they're killing some of those bacteria. Fluoride, which has been in recent discussion. If fluoride works to reduce cavities by killing bacteria on teeth, what is it doing to the microbiome? And so we're now recognizing this has been a part of health we don't talk about that we really need to talk about. And I write a fair bit about it in the book Blind Spots.
Yeah, so we can't highlight everything and talk about everything. So everyone get the book. If you're interested in this stuff, there's a lot more in there. There's stuff about hormone replacement therapy for ladies, and a number of other things. It's interesting to see the history as to why some of these false ideas were perpetuated. And I do want to get into cognitive dissonance in your chapter on that, because I think that applies to every area of life. But one more thing, and this is a little bit personal for me, because I did have a STEMI when I turned 50. And then I had another stent 5 years later. I'm doing pretty well right now, but the misinformation that was out there regarding diet as it affects your cardiovascular health. Can you just tell us briefly about where that came from? And I know you're not here to give dietary advice, but maybe you could help us out. A bunch of guys here, they're very interested in their fitness and health overall. So can you tell us about that?
Well, the medical establishment in the 1960s decided to blame obesity and many chronic diseases on one culprit, saturated fat. And so the pile on began. Some doctors were smart enough to say, wait a minute, there's no good evidence to support this hypothesis. But they were steamrolled, and some of them were just railroaded. And this bandwagon just took on a mob mentality. It demonized fat to the point where it was the number one recommendation doctors gave to patients in a primary care office. Number one thing, the most common thing, eat better, exercise more. Well, how do you define eating better? Starts off with, well, avoid fat, try to eat low fat. We not only got that wrong, but as we were so busy blaming fat for everything, we ignored the role of refined carbohydrates, ultra-processed foods, pesticides, things that alter the microbiome, seed oils, and so many other toxins. We have 1,000 ingredients in our food supply that are banned in Europe. Mm-hmm. Kellogg's makes 2 versions of their cereal, Fruit Loops. One for Canada that doesn't have the bright food coloring chemicals, and one for the United States that does. Now, don't American children deserve the healthier version of a cereal made by an American company? So as we were busy demonizing fat, we ignored all of these other issues that live in the blind spots of food and nutrition, as we had the food industry in a very corrupt way propagate the food pyramid. And to this day, that still lingers in health recommendations and textbooks to this day.
Yeah, I know. And even friends of mine that are actually, one of the guys, Josh Hawkins, he was a little younger than you growing up here in Danville, but he was avoiding eggs because he didn't want his cholesterol to go high. And you have a whole chapter in your book about your uncle. It was your uncle, right, who loved eggs?
Yeah.
And for years, he wasn't eating eggs because the doctor told him he shouldn't eat eggs. I told him, I said, hey, you eating cholesterol doesn't make your cholesterol go up. It's okay. You could have eggs. And so there's that. It just continues.
Well, look, tell Josh I said hi. I love Josh, and that family is wonderful. Tell Josh that a Harvard medical student last month ate 740 eggs in a month, rechecked his LDL cholesterol, and it was lower. And so I don't recommend eating 740 eggs in a month, but it does prove, well, it does shed light on this basic concept that the cholesterol we ingest really is not absorbed by your body. It's esterified. Most of it, 90+% of it, goes right through your GI system. And so there's no need to tiptoe around cholesterol in healthy foods in one's diet.
Yeah. That's good news for me because I like eggs and I like meat. So
Me too.
all right. I know we only got about 5 minutes left, but I do want you to talk about cognitive dissonance, and you have a whole chapter on that. And one of the reasons why we get ourselves in this kind of trouble, and this could be applied to our lives even outside of medicine. So tell us about cognitive dissonance.
Well, first of all, it's amazing learning about this stuff. For me as a surgeon, to learn about this human psychology, this natural tendency we have to resist new ideas. It's not that we're bad. It's that it's a part of the human condition that you have to actively suspend. A tendency to hold on with a tight grip to what you believe, not because it's more logical or scientifically supported than new information, but simply because you heard it first. It's also called the founder's effect. Dr. Joel Festinger, who described this in the 1960s and 70s, wrote about the comfort the brain has of holding on to one idea. Whichever idea you hear first, that belief becomes nested in the brain. And it's peaceful, and the brain likes it peaceful. When a new idea comes along that challenges what you believe, that is uncomfortable. And we subconsciously avoid that discomfort or dissonance by reframing new information to make it consistent with what we already believe, or dismissing new information so we don't have to think about displacing what we already believe. And so it's a powerful effect. Dr. Festinger embedded himself in a cult where he watched the living example of his theory play out, where one of the members of the cult had even told him, confessed, after they were expecting a spaceship to pick them up at a certain date of a prophecy in a certain location. The prophecy didn't come true, of course, and he told Dr. Festinger early in that morning, he said, I can't just not believe this. I have everything invested in this, my family, my friends, my job, my reputation. And it really spoke directly to this idea of cognitive dissonance, of just clinging on to what we hear first. So it is a reminder for all of us to be aware that this is a part of the human condition. It's a natural tendency, and we have to actively suspend that tendency in order to be open-minded and impeccably objective, which is really critical when you're a physician.
Yeah, obviously. And I wrote a question down at the end of that chapter. I said, if a person experiencing cognitive dissonance does not seem to be aware of it, how can one remain objective? And I guess you just answered that. We have to intentionally ask ourselves about, these things that we hold as dogma that may not be true.
Claude Bernard, the father of modern medicine, said in the 1800s that we as scientists and physicians have to be aware of our biases. We all have them. We can't fool ourselves. And then to actively suspend our biases as we consider new scientific information. He said it was an active process, but that enables us to be impeccably objective. And I think it's a good lesson for all of us, because 100% of people who are closed-minded perceive that they are open-minded. Right. So, this is part of the human condition. It's not that we're bad. It's that we sometimes don't recognize this tendency.
Yeah, absolutely. And one of the things you say in here, and we're going to end it with this because you got 1 minute left. You say good leadership requires self-awareness and humility. And at F3, our mission is to develop leaders. We want to develop men into virtuous leaders to serve their families and communities and our country. And I think you're an example of that. We call this the High Impact Man podcast. You are certainly having a high impact on everybody in our culture and our nation and even the world with the work that you're doing in individual lives when you operate and take care of patients, but also in putting out this stuff like in blind spots and And one of your books was made into the TV show The Resident. I didn't even know that until I went back and looked at the book again to get ready for this interview. I'm like, hey, I watched the first season of that. And sorry, I didn't watch any more after that. But I watched the first season at least. So anyway, thank you for the work you've been doing.
Well, look, it's so great to connect, and you really warmed my heart by reminding me of the Spar family and so many other great folks in Danville. So thank you for connecting here. Hopefully we can do this again sometime and keep up the good work.
I would love to do that. And if you ever find yourself up in Danville, look us up because I'd love to sit down and talk to you. I got so many other questions and things I'd like to talk about in the book. And I get in trouble sometimes for questioning the dogma, but sometimes I end up being right. Sometimes I end up being wrong.
Well,
But thank you so much.
Keep going. The purpose of science is to challenge deeply held assumptions. So I love people that ask big questions. So thank you for what you're doing.
Yeah, and thank you, sir. Well, really appreciate it. I don't know what you got next, but I hope it's as fun as this was for me.
Nothing could be this fun, but good to see you, Nevin.
All right. God bless you, sir.
All right. Take care.
Bye-bye. All right, so guys, you heard it from Dr. Makary. There's a lot of other things I would like to get to in the book, but he obviously didn't have time. I hope you this has ignited a desire for you to kind of take a step back and think about what you hold as dogma in your life, and where are you experiencing cognitive dissonance. You don't know it inherently, so you've got to intentionally question. Where are my biases, and are they true or not? And if you objectively look into the truth and look for the truth, I think you'll probably find it. You got to be pretty smart about where you look. Trust your doctor. Okay, the book doesn't mean reading the stuff in this book and some of the things we got wrong means that you should have more distrust in the healthcare system. Trust me, I work in healthcare my whole life. I'm not a doctor. I'm a physician assistant, but pretty much all the physicians I've ever known or worked with are really good people that really want to help you, and they've devoted their lives to researching what works and what doesn't work and the science behind it. And so I would listen to your doctor. Don't avoid the hospital if you need it. However, if you don't need it, the hospital is a place you do want to avoid because we poke you with needles almost every day. So you don't want to experience that if you don't have to. Other chapters in the book, one is about hormone replacement therapy in women and the false information that was put forward that it causes breast cancer. It never was shown to cause breast cancer. And a lot of ladies have gone without treatment that actually when you reach menopause and you get estrogen replacement therapy, it does a lot of really good things, including giving you less chance for heart disease, less chance for Alzheimer's, and many other things. Make you feel better, eliminate hot flashes. So anyway, that's for all of you guys who have menopausal wives and mothers out there. There's a chapter on that. There's a chapter on how we did not recognize, even though there were people out there saying we should, the contaminated blood in the 80s with the HIV, the virus that causes AIDS. And it's an interesting read, that chapter. Breast implants and autoimmune diseases. We talked about the gut biome briefly, but there's a lot more to it in the book. And there's even more. So I would recommend everybody to you. I'm holding it up here. The book Blind Spots by Dr. Marty Makary. It is an interesting read. You can read it if you're a layperson. You don't have to be a scientist or a doctor to figure this out. And I will say one thing in regard to this and F3. And this is something I wanted to talk to Dr. Makary about, but didn't have the time. There was a book, I'd never finished it, and I plan to get back to it. It was put out a number of years ago called Anti-Fragile. And in it, the guy that also wrote Black Swan, which was a #1 bestseller, but I can't remember his name off the top of my head. But the whole premise of that book, and he goes into a lot more disciplines other than medicine, is that in our attempt to mitigate all possible complications, in our attempt to eliminate all risks and things of that nature in every type of discipline, to make the path a very smooth path and avoid all the little bumps in the road in your life. When the bigger things do come and happen, they're much more difficult to deal with, and you become fragile as a system and as a person. And so in F3, we try to combat that by doing hard things, right? So when you go out in the gloom, and no matter what the weather, and it may be a difficult day for you may be tired or whatever, but when you go out there and you do hard things and you do it together with other people in community, like we do with our brothers, you are making yourself anti-fragile. And some of the things he talks about in the book are an example of that in medicine, trying to smooth over every bump. And in our attempt to do that, like the peanut allergy, right? There was no evidence that of having your kids avoid any kind of peanut butter or anything with peanuts in it until age 3 or 4 or whatever. Sounded like, hey, this is a good idea. Let's, the very small percentage of people that had an anaphylactic reaction to peanuts, which was real, and some people did die from that. Say, hey, let's eliminate that. Let's just not have kids have peanuts until they're, older. Well, that just made the problem much, much worse. And again, it reminds me of that book, Anti-Fragile. So, all you guys out there in F3, you're getting out there, you're getting after it, you're doing hard things, you're doing it in the gloom, you're doing it in the rain and the snow and the cold and the heat and whatever. You are doing the right thing. And it serves so many ways. We know this. It helps us mentally, emotionally, and physically. And then we could become better leaders, so that when the big things do happen and the bad things do come, we're better able to deal with it, and we're more virtuous leaders throughout the process. So anyway, Dial Up, are you live now? Can you talk?
I think so. Yeah, that was
I got
weird.
you. I got you now.
Before
Yeah,
we
I can hear
started
you
this
now.
whole thing, your sound wasn't working, and you fixed
Right.
your sound, and somehow it destroyed my sound. So I was just literally a pretty face on this episode, shaking my head in agreement,
Yes.
and smiling, and just looking my handsome self throughout the whole thing
As
until the
always.
end. And finally, you got to
Yes.
hear my charming and sexy voice as well.
There he is now, folks. So what are your thoughts on what you heard?
You wonder how much the fact that we push doctors to be so busy and so overwhelmed with throughput that they don't have time to even investigate these things. They might be questioning it in the back of their mind, but they're not afforded the time to actually do the studying and the research on these topics. And the other thing that goes along with that, and I think he touched on a little bit, is when they do challenge the system, so often they're silenced when they have that counterpoint. And I think that speaks to a lot of society in general anymore, where if you ask those tough questions or you don't think quite like everybody else, you're kind of shuffled to the side and silenced, I guess, is really the best word to say. We saw that some with when the pandemic was happening. Some folks they were asking hard questions. I don't think they were necessarily going too far against the grain, as far as hey, are we doing this right? Are there other options? Are there other alternatives? And they in some ways were just kind of shunned to the side or shucked to the side, because they weren't just following like sheep.
Right.
So those are some thoughts. It brings it up, and I think it reinforces the fact that we need to listen to alternative thoughts and ideas, and then follow the data and follow the research if it's available to determine does it hold weight. Could it be accurate?
And right, and we rely on our doctors to do that work and they do, folks. I mean, they really do. But there's something in that he talks about in the book is sometimes we operate not just in medicine, but in every area of life. We operate in silos, right?
Yeah.
We get focused on what we're doing, and we can become myopic about other things and miss what's going on that may help us or even guide us away from what we're doing that we don't know is the wrong path. And in medicine, we could do that. And that happens. He mentioned Kellogg's. I don't know if he maybe intentionally brought that up, but in the book he talks about the diet recommendations as far as avoiding saturated fats and stuff like that because it causes heart disease. Well, one of the guys that pushed that real hard back in the 60s, 70s when this first started was Dr. Kellogg. And guess what company he owned? Yeah, it happened to be Kellogg's that sells the sugary cereal, which now you should eat and don't eat the eggs, right?
Of course,
There's more in the book about things like that. And so, we're all human, and we can suffer from this cognitive dissonance and myopic way of looking at things and silos and groupthink and things like that. But sometimes we're also maybe have other incentives that aren't so good.
Yeah.
But anyway,
the other thing I was going to
Yeah.
say real quick, sorry. I mean, you touched on the fact that like you should trust your healthcare providers. Like,
yeah,
your providers are out there trying to do the right thing, trying to provide you with the absolute best care
Mm-hmm.
that they can. I
Yeah.
think the thing that I wanted to add, in addition to kind of your little speech that you gave about that, is to remember that like your physician, it should be kind of a partnership and a relationship in dealing with your health.
Mm-hmm.
Not just go in and just listen to them, but like have discussions. And I'm very fortunate with my provider. You know, when we talk about different things that I should be considering,
Mm-hmm.
you know, whether they be, you know, immunizations or testing now that I'm, you know, a respect guy, heart disease risk would be one example. You know, we kind of talk about things because it's not all black and white in medicine. So it's like, you know, what are the benefits for me, for example, to possibly be on a statin because of my family history that I have.
Mm-hmm.
You know, what are the benefits? What are the risks? And have that
Right.
discussion, because, you know, ultimately it's not a you should definitely do this. It's, well, you know, there's some pros and there's some cons, and you make the best educated guess that you can of whether it's something you need to do. I'm not taking statins, just for the record, but I still question, like, should I, because of family heart disease or family history of heart disease. But yeah, we'll find out someday.
Well, I would say, you know, just as your personal cardiac surgery PA, I would tell you that as long as your cholesterol levels are normal,
Yeah.
and you have no other risk factors, and you probably don't need to go on them, it wouldn't be unreasonable to get a cardiac CT scan. So cardiac CT scans are low-level radiation. They look at the calcium scores, amount of calcium deposits in your coronary arteries. You can see on CT scan, and decide if you're high risk or low risk or medium risk for having blockages. I don't know what the recommendations are specifically for that, because where I work, people already have their coronary disease, and we're the people that fix it. You know, Mongo fix. We don't go investigating that stuff, but I think if you do have some risk factors, and family history is the strongest one, if you ask your doctor, you might be able to get, and your insurance may pay for a cardiac CT scan to look at a calcium score. But, you know, statins work outside of lowering your cholesterol.
Yep.
They have some cardioprotective effects in their anti-inflammatory properties and things like that. So if you did have coronary disease and your cholesterol was normal, you'd still be recommended to be on a statin. But, you know, without any of the risk factors and things like that, I think if your cholesterol is normal, then you probably don't need it.
Yeah.
Anyway, take that for what it's worth.
This PCP visit for Dial Up brought to you by Nevin Gorky, PAC, cardiac thoracic surgery. No charge at all. Yeah,
no charge.
Yep.
I happen to be on a high dose statin, and doesn't bother me as long as I take my CoQ10. I don't get the muscle cramps as bad. So it's all good. It's all good, man. Yeah, I think there's a lot of lessons we could take home from this book, from Blind Spots. And if we're going to be good leaders, we have to rely on the people that give us the information, who have dedicate their lives to it, as we've said multiple times here, and your physician is one of them. And one of the things that I worry about is social media and the internet has allowed people to try to be their own doctor.
Mm-hmm.
And, you know, the bro science is a real thing out there. And so if you're a guy out there and you think you know what you're doing, and you think you looked on the internet and you found something that gave you some information, it may or may not be right.
Correct.
And I could tell you that looking at studies and reading this book too, but looking at studies, there are a lot of studies out there that you could read, but you got to know how to read them. You got to know how the statistical analysis was done, and, you know, and if it was a good study or not, and if it was repeated and showed the same thing. Because if you really want to do something, somebody comes forward, does the study for the first time and says, hey, this, you know, X, Y, and Z is what you should do. It has to be repeatable. So somebody else has to be able to do a study like that and have the same results before we really buy into it. So it's a little bit dangerous being your own doctor and looking, and, you know, Dr. Google yourself and your bro science. I see a lot of that in just, you know, people that I know, and patients, and they get dogmatic about it, right? Because, you know, you looked it up, you found it, now, this is mine. And like he said, that implants in your brain makes you comfortable because you think you know something. So Anyway, I think we've beaten that horse to death.
Yeah.
There's a lot of good stuff in the book. I do recommend it. It was an eye opener for me. Even I know that as a healthcare provider, it's a little bit more up my alley. But any of you guys are interested out there, get the book.
Is that a wrap?
Hey, man. I think that's a wrap. All you guys out there, all you F3 guys out there, go get after it. Get after it in the gloom. What you're doing is working.
That's right. Research does 100% support burpees as being one of the best exercises you can do for fitness. So no matter what DFib says, trust the science.
If DFib could physically do burpees, he would be all in on it, but he can't.
Yeah.
Although I queued yesterday. You could queue without doing burpees and still get a good workout.
Yep. He was going 100 miles an hour to start, folks. You should see him.
Yeah. Well, how fast was I going at the end?
50% maybe. 50 miles an hour. But you gave it your all, brother.
Yeah.
That's all that matters.
I gave my all. I brought the Q juice, baby.
You brought energy. And yeah, it was a good turnout. Lots of guys were having a fun time. And my glutes were sore, so you did a good job.
Yeah. I did something right.
You did something right. Yeah.
All right.
All right, brother.
All right, folks. God bless you all out there.
Peace.
Thank you for listening to this week's episode. I would like to thank our guests for joining us and sharing their story of becoming a high-impact man. More information and resources can be found at highimpactman.com. If you like this podcast, please consider following us on our social media pages or email us at him@highimpactman.com. That is HIM@highimpactman.com. The High Impact Man podcast has a new episode every week, and you can find them on Apple Podcast, Spotify, and Google Podcast platforms. Have a great week, everyone.